I'm here today with Dr. Abby Sexton, OB/GYN here at UnityPoint Health, Fort Dodge.
I chose obstetrics and gynecology first and foremost to take care of women and be a voice and an advocate for women and their health. I also loved the field because it's such a nice variety of obstetrics, gynecology, procedures, surgeries, deliveries, and office.
So you get to do a little bit of everything in your practice. Yeah. Today we're going to focus on more the GYN part of our practice. What kind of surgeries do you do in gynecology with the robot?
So the main one we do is hysterectomy, so removal of the uterus. We also can do like ovarian cystectomies where we remove cysts or masses off the ovaries. We can do tubal ligations or removal of the fallopian tubes for contraception. We can also do endometriosis excision or diagnostic laparoscopies where we look to see if a patient has endometriosis and then remove it for them. For us, we make small incisions in the abdomen while the patient is laying on the table. And then we insert our trocars and we connect the robot to those trocars in the abdomen. So the robot is over top of the patient. Once it's docked, then we sit at the console. These here are the eyepieces. So what we see in here is what the camera is seeing inside the patient's abdomen and pelvis. These are the joysticks that we're able to move our hands around. When we move our hands, that's what moves the robotic arms to perform the surgery. So during the surgery, we sit here and operate like this.
So you're right here in the room.
Yes.
You're with the patient the whole time. Mm-hmm. You get things aligned and started.
Correct.
And then you are still in the room. You stay in the room while you're using the joysticks to move with your hands.
Yep. It has been able to allow us to do more complex surgeries laparoscopically or minimally invasive. So instead of having to do an open procedure where we make a larger incision for the patient, we can do the same surgery through smaller incisions, which decreases the amount of time they stay in the hospital, their post-op pain, and their recovery is much easier.
What's the process that would get me to have a consultation with you in your office before this?
We see a lot of patients in our office for common gynecologic concerns, a lot of abnormal uterine bleeding or heavy painful periods, pelvic pain mainly, and those kind of topics or problems that patients have can potentially lead to needing surgery. So that's how after a workup in the office to see why somebody's having heavy painful bleeding may result in the treatment of a hysterectomy, and then that would lead to having a Da Vinci surgery.
So come to you or one of your colleagues in the office to be seen if you have these symptoms, and then you would determine if the robotic surgery is right for you.
Yeah, correct.
Tell us a little bit about what got you here.
I went to Des Moines University for medical school, did my third year rotations here at Fort Dodge. So I spent a year in the hospital as a medical student and loved it here. I loved the community, the hospital, the people, and so decided to come back and practice here.
Love that. Well, thank you so much for spending time with me today and for educating us on this new robot, as it's new for a lot of us. Really great to be able to have a physician that was trained in medical school on it and now using it here in practice. Yes. So thank you for joining us.
Of course, thank you for having me.